So this is the right coronary artery showing you two lesions, one at the top and the other at the bottom. And this is the placement of the first Absorb stent commercially available in India at 7:33 a.m. And if you see here, this is typical of this Absorb stent, that there are two markers. One is the distal marker as shown by the arrow, and there is also a proximal marker which is shown by the arrow now. The other two dark dots are the dots of the balloon. So this is the first absorb stent placed at 7:33 a.m. on the 20th of December 2012 by Dr. V.T. Shah and a patient known as Mr. Natarajan. Now we go to the second absorb stent being placed in the proximal lesion, that is the lesion above. Now see again the same characteristics of the absorb stent. This is the placement of the stent being done, and this was at 7:47 a.m. That is the second absorb stent being deployed in the right coronary proximal lesion, and now you can see the final recording or the final picture of this, both the absorb stents being deployed in the right coronary. You see the smooth lumen, that the narrowings are gone, the blockages are gone. And now as we take the check shoots of this and confirm that things are okay now and stable, we then go to the next artery, which is the circumflex artery on the left side. Now this is the lesion on the left side in the circumflex artery. As you see here, there are almost 4 narrowings in this artery. This is at about 8:07 a.m. immediately after 7:47 a.m. Now what we do is that at 8:22 we deploy the third absorb stent covering the 3 lesions. We could not cover all the 4 blockages in one stent, and therefore we had to deploy 2 stents in this artery. One distally, as we see here, with both the dots there of the absorb stent. Now this is deployed distally to cover the 3 blockages, and this is the fourth absorb stent at 8:44 a.m. being deployed. You see again the markers on the absorb stent, as I said, the hallmark of the stent, and this is the placement of that fourth absorb stent being done. And as you see here, that the positioning is being done and then the stent is deployed. We show you the markers, the distal marker and the proximal marker, and then the marker which you see here belongs to the stent which is down below deployed. And this is the final result after post-stent dilatation. This is the final result as you see here, and this was finished by 8:54 a.m. So all the 4 absorb stents were deployed from 7:33 a.m. to 8:54 a.m. in one sitting, covering all the 4 lesions. This is the final picture on the circumflex side. As you see, it's a big artery and a large size absorb stent was deployed in this.